Hello, my name is Forrest Rieckhoff. I'm currently a second-year medical student at St. Louis University. The topic of my presentation is infections among veterans treated with enzalutamide or abiraterone in advanced prostate cancer. Abiraterone and enzalutamide are hormone therapies used interchangeably to treat metastatic castrate-resistant prostate cancer. Abiraterone is given with prednisone to prevent hypertension and hypokalemia. The aim of this study was to determine causes for hospital admissions among veterans with metastatic castrate-resistant prostate cancer treated with abiraterone or enzalutamide. 5,895 veterans treated with abiraterone or enzalutamide from September 2014 to June 2017 were identified using the VA informatics and computing infrastructure and then were followed until April of 2020. We used the first three ICD-9 or 10 codes upon discharge from the VA hospital and analyzed them to determine the cause of admission. Diagnosis codes for UTI, sepsis, and pneumonia can be found in the bottom left corner for their definitions. The primary outcome for this study was hospitalizations. Next to the methods section titled Hospitalizations per Veterans, this graph depicts that the majority of patients in this cohort were not hospitalized at all, at about 58%. However, just over 40% were hospitalized, a minority of which were hospitalized up to 5 or more times. Above this, the top middle graph shows that UTI, sepsis, and pneumonia were among the top diagnosis codes for hospitalizations, totaling 1/4 of the total admissions overall. This indicates that infections is one of the primary risks for hospitalization among this cohort with metastatic castrate-resistant prostate cancer. Among the other top contributors for admission were cancer pain and acute kidney failure. Next, hospitalizations per treatment. This graph shows that the percentage of unique patients admitted to the hospital based on treatment with abiraterone or enzalutamide. As you can see on the left, there was a statistically significant increase in hospitalizations among patients treated with abiraterone compared with enzalutamide on the right. In conclusion, infections were among the top causes for hospitalizations, including sepsis, pneumonia, and UTI, which accounted for 1/4 of total admissions. Patients treated with abiraterone were also hospitalized more frequently than those with enzalutamide. Future research is needed to determine if there is a difference in infection rate based on treatment with abiraterone or enzalutamide. Also, we should define patients with metastatic castrate-resistant prostate cancer who would benefit from enzalutamide based on comorbidities or concomitant medications prospectively. Thank you for your time.